Welcome. We're here at HIMSS 2019 with our good friend Nagi Prabhu. He's Chief Product Officer at Solutionreach. Hey, welcome Nagi.
Thank you.
So it's great to have you here, but you know, at HIMSS there's been a lot of discussion, but as you look into the future of patient communication, what are you seeing?
Well, I have a 21-year-old son, and in last 5 years I have, he's on my phone bill, and last 5 years he has not picked up a phone. And as I walk around in the thing here, I see people talking about making phone calls to their patients to confirm appointments or tell them the instructions. I also hear people saying they have a 300 people contact center to interact with patients. In my mind, that is broken. So the way I look at it, the interaction is going to change. It is going to become more patient-centric, more personalized. The whole communication paradigm needs to change with the changing dynamics, changing patient focus to become more individualized, personalized, value-based communication, and that's where we see that communication going.
No, that's exciting that the patient's finally at the center. And
yes.
You guys announced a solution that I think is very patient-friendly, which is a payment solution. So tell us more about that.
Yeah, I mean, if you look at the providers today, the time it takes them, they have two big problems in revenue cycle management. One is how long it takes them to get a payment. So if you really look at it, it takes them 30 days on an average to do the invoicing, and then at least 30 days to 60 days to get the payment by check. The second problem is, if you look at the statistics, longer it takes them to get paid, the harder it is for them to collect. So there is a statistics that says about over 30% of the patient bills get unpaid. That means it's a lost revenue. So what we are trying to do is bridge that problem. So there is a communication that's the most effective to communicate with the patients, which is texting, right? 90+% texts get opened. So what we are doing is using that medium to help do a better job in revenue management. So once you know what the bill is, you simply text the patient saying that here is your bill with a link. So the patient on their mobile phone can click on the link, open it up, they know, they put their credit card, done. So instead of licking the stamps and sending the envelopes and spending money for doing that, it is one click and the patient can respond instantaneously and you get paid. So it's a huge change on how you do your revenue management.
No, I think it's beautiful. I always say, if you don't want me to pay your bills, send it in paper, because
yeah, that's exactly
I'll forget
right.
about it, I won't buy
And
it.
I never pay my bills unless I get 3 notices.
That's true in healthcare. But so this works across all practices, dental, medical,
It doesn't
everything.
matter. It doesn't matter. As long as you have the patient's cell phone number, you can text it to them, and then it works beautifully across any market.
Impressive. So where can people go to learn about Solutionreach and about this payment solution?
Well, you can certainly come to our offices in Lehigh. We have 500 plus
Lehigh,
people.
Utah. Beautiful.
Lehigh, Utah, yeah. So we have 500 plus people right now working on doing new things in modernizing the patient interaction. But certainly www.solutionreach.com is the perfect place to come and get more information.
So if they don't want to go skiing in Utah, they have to go online.
Skiing or hiking.
Yeah, that's fair too. That's great. So, you know, anyone that's watching this, what's your big takeaway that you'd want them to know about you and about Solutionreach and your goals?
Yeah, so Solutionreach has been in the industry for 17 years doing this patient interaction. And in my new role as a Chief Product Officer, my mission is to actually fulfill the vision that we have set, which is to revolutionize the patient-provider experience in healthcare. So we are bringing a lot of new products in the market because we have this data that we have collected about the patient and the provider interaction for last 17 years. So we are bringing a lot of technology like machine learning, AI, natural language processing, data science into that to create a better understanding for the provider on the patient's preferences. Think of this. In retail today, if you are a customer of Amazon, Amazon knows what you want, when you want it, when are you going to buy it, and how much you are willing to pay. But whereas in the healthcare, the provider my life depends on the provider, he knows me as a social security number or an insurance card. That needs to change. So what we are doing is revolutionize that whole communication from patient acquisition to interaction, pre-care, post-care, and make that patient-provider interaction very personalized, because as this whole industry is changing into value-based industry, and number of underinsured is going up. It's like almost 50% now who are underinsured. So people feel that they are paying from their pocket. And when you are paying from your pocket, your expectations are very different. Your expectations are, don't treat me like a number. So, and I think what we are doing is to be able to create a software platform that actually addresses the patient's need to be treated in a much better way, in a more personalized way, and the providers need to provide a better care and educate the patient better and take care of the patient better.
Sure. You know, when you were saying that, I heard all these patients applauding, like, finally you care about me as a patient.
Yes, I think the time has come. The time of patient has come.
Yeah.
So that is what the patient experience platform that we are providing for every industry. I mean, today we have over 25,000 customers using our platform.
Wow.
And we have a very satisfied set of customers. We have a 150 NPS score, if you believe it, so which is phenomenal. And we have customers from single practitioner to enterprises with thousands of providers. So what we are intending to do as we go further is use that experience to further expand to larger enterprises, because the needs of larger enterprises are different. And if you look at the patient communication market, there are a lot of providers there. Most of them are targeting SMB, single provider or multi-provider scenarios, but there is not a single solution that caters to the entire gamut. And what our intention is to continue to expand our platform so that it can be applicable for much wider set of industries and specialties, as well as much bigger organizations as we go forward.
I think we all need that. So we all get service from those. So we're excited. So thanks so much for sharing your insights. Thank you for sharing your perspectives, and thanks for everyone for watching back at home. We've been here with Nagi Prabhu. He's the Chief Product Officer at Solutionreach. If you want to find more great content like this, check it out at healthcareittoday.com. Thanks.